Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is May 21st, 2025. This video is on a Lancet article on transcatheter heart valves for transcatheter aortic valve implantation. It's the COMPARE-TAVI 1 trial, a multi-center randomized non-inferiority trial where they compare SAPIEN 3 versus Myval transcatheter heart valves. There's an accompanying editorial in this Lancet article. Aortic stenosis is the most common valvular disease in high-income countries with poor prognosis if untreated. TAVI is now widely used in all surgical risk profiles. New transcatheter hepatic valves, example Myval, need head-to-head comparison against established ones, example SAPIEN 3. So this trial, the COMPARE-TAVI trial, was the first direct one-year comparison of SAPIEN 3 versus Myval valves. The design, it was a multi-center randomized non-inferiority trial at 3 Danish hospitals. 1,031 patients aged above the age of 18 underwent transfemoral TAVI. Intervention, randomized to SAPIEN 3 Ultra or Myval octocore valves. The primary endpoint was a composite of death, stroke, moderate or severe aortic regurgitation, or transcatheter heart valve deterioration at the end of 1 year. What did they find? Myval was non-inferior to SAPIEN 3 for the primary composite endpoint, 13% versus 14%. P-value for non-inferiority was equal to 0.019. Myval had higher pacemaker implantation rates, 21% versus 12%, p-value 0.0002. SAPIEN 3 had less moderate or severe aortic regurgitation, but higher gradients and similar effective orifice areas. There is no difference in one-year mortality or stroke rates between the valves. Key takeaways. Myval transcatheter heart valves are viable alternative to SAPIEN 3, showing 1-year non-inferiority. Higher pacemaker rates with Myval require caution and further study. Hemodynamic advantages of Myval, larger effective orifice area, could impact long-term outcomes. Future pooled and long-term data will reveal durability and refine valve choice strategies. The accompanying commentary said that this trial showed a high enrollment and real-world inclusiveness. 77% were randomized. The Myval valve demonstrated non-inferiority to SAPIEN 3 at 1 year. Complex anatomies were included: bicuspid, valve-in-valve, real-life dimension. The concerns: higher pacemaker rates with Myval, probably due to valve design and unfamiliarity. More paravalvular leaks suggest SAPIEN 3's superior sealing technology. Lack of balloon filling data limits insight into oversizing and valve performance. Not generalizable to younger, those below the age of 75, low-risk populations. Key for lifetime TAVI strategies. CT-based studies needed on frame expansion, commissural alignment, and small annuli outcomes. There was an article yesterday published online on the ACURATE study in the Lancet. ACURATE Neo2 is a self-expanding TAVR valve used globally, but not FDA approved. Trial compared it with SAPIEN 3 evolution in severe aortic stenosis. This is a multi-center randomized non-inferiority trial in 1,500 patients across risk profiles. Primary endpoint was death, stroke, a composite of death, stroke, and rehospitalization at 1 year. The findings were the primary event rate was higher in the ACURATE Neo2, 16.2 versus 9.5% in the control. So non-inferiority was not met. More cardiovascular deaths, strokes, myocardial infarction in the ACURATE arm. Hemodynamics, lower gradients but higher paravalvular regurgitation with the ACURATE neo2. So the key takeaway, largest TAVR head-to-head randomized control trial, ACURATE neo2 underperformed, design or deployment modifications be needed. So both these trials said that the newcomers need to be modified before they can be non-inferior. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.